Welcome to the Doc Lounge podcast, Crazy Cases series. In this series, we will explore some of the most unusual and interesting cases medicine has ever seen. We will speak with providers of all specialties from all over the nation. We will hear first-hand accounts from symptoms to treatments to cures. So sit back, relax, and let's explore some crazy cases. Hello, everyone. Thank you guys for tuning in to the Crazy Cases series of our Doc Lounge podcast. And today I'm lucky enough to have two co-hosts. So joining me is Regional Vice President of Business Development here at Pacific Companies, Mr. Rob Miller, and a special friend of the Doc Lounge podcast, Physician Assistant Cassandra Karn. For today's episode of Crazy Cases, Rob, Cassandra, and I had the pleasure of talking to Dr. Stephen Kushel. He's a board-certified emergency medicine physician, currently practicing out of Pasadena, California. So Dr. Kushel brings us back to a case that is extremely interesting and definitely something different than we've heard in the podcast series so far. Left me speechless. I still don't know quite what to think of it, so it's open for interpretation. I don't want to give too much away as usual, so hang on after this quick disclaimer for our episode with Dr. Stephen Kushel. And just a quick reminder, every episode of Crazy Cases is HIPAA compliant. All names have been changed and all personal patient information will remain private. So that being said, let's get started. Hi, Dr. Kushel. Thank you for joining us today.
No problem.
So paint a picture for us. Take us back to the beginning. How did the patient present themselves to you and what were the symptoms?
Well, basically, this happened a long time ago, and it was actually in the Northeast. I was the attending physician, ER. I was working a night shift, and the medics bring in this 18-year-old girl who they found unresponsive, and apparently the initial thought was that it was a intentional overdose slash suicide attempt. When the patient arrived in the ER, she was totally unresponsive. Her core temperature was 92, but she was maintaining airway and her ABCs were fine. So we do what we normally do, is order a whole bunch of tests. And as it turned out, the Tylenol came back 100, with a toxic dose being for a 4-hour is above 140. For a 12-hour, be above, I think, 40 to 50. This is 400. And when we ran the other tests, she had all the signs and symptoms of fulminant liver failure.
Oh my
God. Her liver functions were off the scale. Her coags were off the scale. And at the time, our main hope was to keep her alive long enough so that she could eventually get a liver transplant.
Yeah.
And we found out late, and this is an addition which helps with the history. Her mother was a surgical ICU nurse, and her father was a psychiatrist.
Oh, wow.
So as we like to say, she had two strikes against her. And apparently, as it turned out, she actually had taken the Tylenol probably 10 to 12 hours before both parents were away. Back, they found her in that condition.
So sad.
And we did the usual things that you did at the time, aside from ordering the lab test. Everybody got charcoal. In her case, through an NG2. Then when we got the Tylenol level, she got an acetylcysteine. Because again, back then, they didn't have the IV version, again, through an NG2. And as I stated previously, we just kept monitoring her, but she still remained unresponsive. She got placed on a hypothermia blanket. And shortly thereafter, her mother came in, and this is kind of where the interesting or unusual part came in. They were East Indian, so the mother came in, had this bag full of ash, she started rubbing the ash on the patient's abdomen and saying a mantra. And a couple minutes later, she just woke up and said, "Where am I? What happened?"
Was the mantra in a different language?
I don't know the exact dialect. It was in
Yeah.
some, East Indian, Punjabi, one of them. But yeah, and all of a sudden she sat up. And to this day, we couldn't explain it. There wasn't anything we did. We did transfer her to Mount Sinai Medical Center, which at the time was the liver transplant center. And because the mother was an SICU nurse in our hospital, we were able to get follow-up, and believe it or not, according to them, she recovered 90% of her liver function.
Wow.
With no other intervention besides?
No, just with all she got was charcoal and N-acetylcysteine. I'm assuming they did the normal protocol. But as I stated, at that point, her INR was like in the 8 to 9 range. Her liver enzymes were off the scale. I mean, as I said, our main goal was to keep her alive so that she could get a liver transplant.
Wow. And those are numbers, like once your liver is at that stage, it doesn't bounce back, right? You need a transplant.
It's not supposed to.
Wow.
I mean, she had, by all signs and symptoms, fulminant hepatic failure. And again, the hypothermia she had, which, remember, Tylenol works for fevers. And if you take a whole lot of Tylenol, it will make you hypothermic.
Huh.
So everything was consistent with massive acetaminophen overdose and fulminant hepatic failure.
I have a question, Dr. Kushel. As you're set the scene for us, you're in a room and you guys are doing your best, and the mom walks in and she's carrying, is it like a bag of ashes? Is it a box or whatever? And are y'all just standing there watching her do this, or how does that go down?
Yeah.
Wow.
I mean, she walks in and she has this little, sort of like a silk little purse or sack. That women would keep cosmetics in.
Right.
And then, we're watching with disbelief. And she just goes over, puts this on her stomach, starts rubbing the stomach. And literally within minutes after she's done, the kid just wakes up, literally opens her eyes and sits up and says, "Where am I and what happened?" It's like we were staring at each other.
Wow.
Did anyone find out, was her mother a healer, or did she have some type of Eastern medicine, I don't know, specialty?
We didn't bother asking that. I mean,
You're in too much shock at that point. I'd be interested to know, though. I mean, it can't be that everybody knows to say the mantra and rub ashes.
Literally, everyone's jaw dropped, and we were just staring at each other. Like, huh?
Oh my
wow.
God. Yeah. That must be one of the stories that's legendary and people still tell.
Yeah, I mean, again, I've been practicing over 25 years, and I've seen the weird, the bizarre, people doing weird things to themselves, but nothing like this.
I was actually going to ask you, Dr. Kushel, I mean, with what you just said there, with practicing over 25 years, is there anything that walks through the door that you see now that surprises you, or is it just all just kind of, I've seen it, done it, bought the T-shirt?
Pretty much. I mean, I've seen people stick weird things in weird places.
Wow.
And I mean, I've seen interesting things. I mean, I saw one guy who came in with the cough when we got the x-ray. It's like, huh. As it turned out, the guy was a carpenter. And basically, carpenters put nails in their mouth and take them out.
Yeah.
Somehow this guy inhaled. So we got the x-ray. There was a nail in his right lower bronchus.
Wow.
Good gravy.
Yeah.
So this brings up another great question. I've always wanted to know this. I'm so glad I'm on this podcast. So, as you as an ER physician, do you guys, okay, certain times of year where you know it's coming, right? They're all hands on deck. So like, okay, it's Halloween, everybody's all hands on deck, or it's New Year's Eve, or 4th of July, or there's just something crazy that's coming in that just meets or exceeds all expectations regarding, just different times of year where it's crazy, or is it just, what is it? Do you see those types of things where it just peaks and like, or what do you see with what you do on that every day?
Usually, if there's a holiday on a weekend and a full moon, watch out. That's like triple hex. I mean, a holiday weekend with a full moon is like,
wow.
Yeah, I gave up working New Year's Eve a long time ago because of that. Because way back when I was teaching faculty with the EM residency program at a trauma center, and I happened to work in New Year's Eve, and I think we saw about 36 traumas.
Wow.
Yeah, it was great experience.
Coffee.
It was great experience for the residents.
Yeah.
But, after that, I said, I'm never working on New Year's Eve again.
Why put yourself through it?
Yeah. I mean, when you're young, you're enthusiastic. As you get older, it's like, yeah, I'd rather take a more sedate day. I mean, and of course, the new wrench this year, of course, is COVID.
Yeah.
Mm-hmm.
That changed the equation on everything.
Sure.
So, I know. So now we all have to get dressed up in spacesuits.
Yeah. Has it been a particular challenge for you practicing medicine lately with COVID, or what has been some of the biggest challenges you've had with that coming through?
I mean, it just adds complexities to our life. I mean, someone comes in with a fever and a cough. Normally before, we weren't too excited about it. Now someone comes in with a fever and a cough, you have to get gowned on, wear your PPE or PAPR, and just adds time. So, and of course it bogs down the ER. It bogs down the ER because in almost every hospital, even if you admit the patient or even if you have to transfer a patient, no one will accept it unless you do a rapid COVID test in the ER.
Wow.
Yeah.
Yeah, so that's got to be bogging things down, right?
Yeah, and of course this winter, God knows what's going to happen.
Yeah.
Yeah.
I'm hoping for the vaccine.
Yeah.
I think we all are, just so we're clear. I think we all are.
Yeah. I think I'll be one of the first ones to take it. It's like, give it to me.
Yeah.
Actually, I was disappointed. I had the antibody test, and I was negative. I'm like, come on now. All this exposure, you mean to tell me I didn't develop any antibodies? Come on.
Yeah.
Something.
Maybe it was an inaccurate test.
No, I mean, you could say the swabs may be inaccurate. The antibodies are pretty, of course, they're quantitative tests. They're accurate. I was just disappointed.
Yeah.
It's like, come on.
Mm-hmm.
So I'm kind of wondering, back to your initial case, because it's so interesting, did it change you as a practitioner, as a physician, to see that? Like, do you believe more, when I don't know if you see it in Pasadena, but when people do cupping or acupuncture, just kind of those other treatments.
Alternative.
Yeah. Because I feel like I'm more open to them now just because people constantly say they work. You give them a little credence, but you had a real experience.
Yeah. And actually, I get acupuncture. And actually, I've studied martial arts for 15 years. And I go up until now, twice a year to see my master in Hong Kong for training. So as far as Chinese medicine and healing, again, like everything's taken in the right region, it works. I really want to get it as a cure for cancer. But if you know the limitations of the modality, it actually works really well. And I tell people who go in the ER, who come in with back pain, I tell them to go see an acupuncturist or a chiropractor. I go, all I can do is give you pills. They'll cover it up. They really won't do anything. Of course, the only caveat with that is most of the patients I see have Medi-Cal. And of course, Medi-Cal won't pay for traditional Western medicine. They'd rather pay for your everything else, including your chronic opioid prescription, which again, I wish they could reform, but
Yeah.
it's hard to turn around a ship going full speed.
Yeah. Yeah, that's really a loss. That winds up costing them a lot more money with the opiate crisis.
It's also especially the workers' comp, because for a while where I worked, we did a lot of workers' comp, and we all got to be QMEs, qualified medical examiners. And it was strange. Anytime we asked for physical therapy, we always got no. Insurance companies said, just give them the drugs, they'll be fine. I'm going like, if we get in physical therapy, they'll be able to come back to work sooner, and it will cost you less. No.
Yeah.
So again, you're fighting City Hall, which is hard. For our case, I didn't mind because we had our own regular workers' comp clients, and the way we are reimbursed is per patient seen at that point. So want to come back every 2 weeks, I'll say hi and bill them for it. It's fine with me. But I actually have patients who wanted to get work, and the workers' comp insurance companies were saying, no. You have to wait. They wanted you to wait 6 weeks before you could start physical therapy. And we're like, that's really a stupid idea.
Well, insurance companies don't make money on all these alternative medical approaches, so they don't want to recommend.
And opioids are cheap. They're like 30 cents a pill. So even if you're taking it 4 times a day for 30 days, 120 times 20 is still what, $24? Something like that. Just as I was saying in my head, it's cheap for them to take $24 and pay a physical therapist $60 or $70.
I think the best part of physical therapy, besides the actual therapy, is that the person feels like their pain is being supported, and it's almost like a mini therapy session as well, because the physical therapists are amazing.
They're really good. Oh, which reminds me, if you want to hear another quick story about myself, this is talking about Asian, Chinese medicine. As I said, I've done a lot of martial arts. And a few years ago, I was having a problem with my shoulder, because when I was younger, I was an athlete. And so I went to a very renowned orthopedic surgeon. We tried everything, physical therapy, steroid injections, and he was about to set me up to have some arthroscopic surgery. In the interim, I went over to Hong Kong to see my master, and she gave me some exercises, and within 2 weeks, I had no longer had any pain. I've had no pain since.
Wow.
Yeah.
Yeah, I believe it. And they have studies and studies of cancer patients that have good attitudes and positive thinking, and they beat cancer. It's crazy.
Yeah. Spirit and spirituality is a big factor in health and well-being. Unfortunately, as most of the people I work for say, you can't bill for that. So,
yeah.
Well, thank you so much for spending your time with me or us and sharing your case. Super interesting, and definitely one that I sure will be talking about. But yeah, I really appreciate it.
Yeah, nice to meet you.
No problem.
Yep. Thank you, Dr. Kushel. Very great to hear you
All right,
talk about
thanks
that.
for speaking.
Have a great day.
Thank you.
Enjoy.
Bye.
Bye.
Thank you to all our listeners. If you'd like to be notified when new episodes air, make sure to hit that subscribe button. And a big thank you to Pacific Companies. Without you guys, this podcast could not be possible. If you would like to be a guest, go to www.pacificcompanies.com. Thank you.